Hello, I'm your host, Ray Dogum, and welcome to the Vibecast. Thank you for joining us as we explore the exciting advancements in technology-enabled collaboration to excel important drug development. Vibe Bio seeks to find every cure for every community. We think big as no one should be left behind in the pursuit of living a healthy, happy, and productive life, free from disease. Collectively, we have the skills, we have the technology, and we have the passion. We now need the community catalyst to bring it all together. That's Vibe. We see a future where communities of biopharma experts and patients collaborate to identify high potential rare disease medicines and have the ability to access capital on demand to actually develop them. The Vibecast is our informational weekly podcast as we explore some of the hottest topics in drug development and technology innovation with some of the dynamic people that make up the Vibe community. Join us to learn, imagine, question, and help us identify and develop solutions together. Our guests today are Jenny Diggles and Dr. Michael Nova, co-founders of JennyCo, which seeks to build a Web3-based healthcare data exchange and allow patients to own their own health data. Before we get started with questions, would you both please tell us about yourselves and your career paths so far? We start with Jenny.
Sure. So I would classify myself as an entrepreneur primarily, and I'm a business person. I kind of got into business actually by way of finding it very curious how people make decisions. At first I thought it'd be psychology, and I was like, no, this is all the decisions that we make. So my career has taken me through a couple of different paths, which actually are, weirdly enough, have coalesced into what we're building right now. But at the time, they didn't seem like they would. So I have done everything from building tech startups, digital agencies. I was even on a weird TV show for Apple at one point for an app that I built. And then over the last decade, I was involved in really developing businesses within the cannabis industry. And that's where I met Dr. Nova. We built something originally that was in that space. And then over the last, 5 years or so, we've been working towards this goal of building JennyCo.
Awesome. Very interesting. Sounds like you had a lot of, a variety of different experiences that has led to this kind of point. That's really cool.
I'm curious. If I'm curious, I can't not look at something. I can't keep going down the path. So because of that, I definitely have taken lots of different twists and turns, but I've enjoyed all of it.
How about yourself?
I'm Michael. I basically have the same constitution as Jenny does around curiosity and being attracted to new stuff and doing new stuff. My background's in computer science, but I ended up going to medical school, but never really practicing. I just got involved with the whole business side of technology, really like new technologies, and put together a number of companies, took one public. The last company before where Jenny and I met was a genetic testing company, and so we had this idea for potentially dialing in your genes to the best cannabis strain, for sleep and what have you, and that kind of interaction between Jenny and myself kind of formulated over a number of years the whole idea around data is really valuable. I'd been involved with the artificial intelligence community in the past. One of my past lives was dealing with IBM Watson, and I put together kind of the first genetic program with IBM Watson to try and get the IBM system to work. But unfortunately, there was no machine learning in there. But it was a good, learning process for myself. And so this whole idea of, how can we make healthcare more accessible for the consumer? And how do we make the consumer benefit not only from things we tell them to do, but also potentially monetarily, with a reward system. So we kind of all put that in place using Web 3.0 and blockchain and artificial intelligence, those kind of three big hooks.
Very interesting. And I think that's a big issue or a big challenge, I would say, for patients and providers really, is to think about how do we incentivize, how do we nudge patients to do what we think is the right thing? Because the right thing is actually different for each person, right? You mentioned genetics and how you had a company where you would recommend a specific cannabis strain based on their genetic makeup. So that's kind of interesting, right? But you can apply that to a variety of different medicines, not just cannabis, right? Do you want to build on that?
I mean, you can apply to a variety of different things, not just medicines, whether it's foods or skin. I was trained as a dermatologist, so skin care, everything you're basically every healthcare outcome or everything that you do is about 30% genetics based, and then the rest is lifestyle. And lifestyle means what you eat. Do you exercise? Do you smoke? Do you drink? All these kind of day-to-day things. So your genetics aren't the all in all. Basically your genetics are there, but your lifestyle kind of turns the genes on and off, either good or bad, depending on what you do. So you can really modify whatever kind of genetic risk you have, whether it's a risk for a disease or how a drug metabolizes. So they go hand in hand. And that was one of the big things about JennyCo, is putting this kind of hand in hand together. It's not just genetics, it's all this other data that we collect, and the data that's really valuable, right? It's valuable for us to be able to help make recommendations, but it's also valuable for other people to potentially mine, to glean information out of that big the healthcare data kind of stack.
Absolutely. Yeah. I would add to that, medicine is a big part of it, customized medicines. Like when we look at how many people can have bad reactions, or they get a dose that isn't sufficient, or it might be too much for them. Those are big problems. That's a big problem. I find it very interesting whenever I go to a doctor and you fill out a questionnaire, they ask, what medications are you allergic to? Well, none that I'm aware of, but I haven't been given every medication under the sun. And so there's a lot of potential gaps that come into play there. It also does apply to things like supplements. Like I've been doing a very deep dive on my own well-being, my genetics, where I have deficiencies and what's going on. And I figured out there were just a couple of small tweaks I needed to make to some supplements. It made a huge difference. And so empowering people with that knowledge allows them to start making those steps in their own life. And it also can empower doctors, medicine creators, you name it, to find better solutions so that everyone can be healthier, and hopefully not on as many medications if they're customized and tailored to each person.
Absolutely. And I think that really makes a lot of sense. And I hope that's the future for our healthcare system as a whole. I think that, there's a lot of talk about this sort of system being built out, but it's really just a challenging thing to do, partially because of the regulation around data and data privacy. So do you guys have any opinions on why data privacy, or how important data privacy is for patients?
Yeah, I mean, sure. I could start there, and Jenny can certainly chime in. But we are well aware, being in the healthcare business, we're well aware of all those regulations that we have to follow. So if we have a blockchain component, it has to be HIPAA compliant. The data storage has to be GDPR compliant. If you're moving data around, there has to be file compliance. So all these compliance networks we're building in to our Web 3.0 system. And so we're very, it's a complicated problem, but it's doable, right? To put whatever safeguards we need to put in there. And the blockchain by itself adds a layer of security and privacy that you wouldn't get in a centralized system, because the blockchain is immutable. It's harder to hack into, it's harder to spoof, and all these other things. And so we're actually kind of more compliant on the privacy and security side than we actually have to be from a regulatory standpoint.
Yeah. And it's so important to have privacy for each person. We each only have one body. I don't get to live in 10 different bodies. I have this one. And, it's mine. And the things that I'm doing to it are very specific for myself. And I wouldn't want my information to be out there. But the challenge is that it is, it is out there. My name may not be on it, but it is still my data and it's out there. So right now, a lot of people are very unaware that their medical data is being bought and sold on an open market, compliantly, because it's not identifiable to them. But that still doesn't feel quite right to me. It's almost like somebody being able to go through every drawer in my house, every single thing I own. But just because they don't know that I live here, that makes it okay. Like there's just something not right about that to us. So while we can't stop that from happening, we do feel like by giving our customers the autonomy to collect their data, to store it securely, and then choose to use it to get insights around their own health, or choose to use it to lease it compliantly to get that money back to them, that's a big deal. So it feels like a power that people have, and they just haven't realized how they can use it yet.
That's so interesting. Can you tell me more about the product and how it works? Like, what is the experience like, for example, a patient who would like to use JennyCo?
Yeah. So right now we're building out our app, and our MVP version is very close for being released to initial testing groups so we can get feedback. So what we're looking to do with the app is like I mentioned, give it a way for people to very easily contribute information to it. And this can come from a variety of ways. This doesn't just have to be straight up old electronic health records. This can be genetic tests, food allergy tests, questionnaires, what their Fitbit said they did that day. There's all sorts of ways that data comes together. So we give them a place to put that data first and foremost, and we incentivize them to do that. So we use our JennyCo token to incentivize that by getting their data on there, putting it in one place. So then they can start to use AI to analyze it and ask questions very specific to themselves. How many times a week should I be working out if I want to lose 10 pounds? What should I be eating? How can I improve my sleep tonight? Whatever the questions are, they can be very specifically tailored back to that person rather than a generic overall answer. Everyone should be getting 8 hours of sleep a night. Well, that's not the case for everyone. So that's one piece of it. And then the other component of it is how we allow for that data to be accessible compliantly and through insights only, not through like data scraping, data ownership, but allowing the companies that are already wanting to have access to this data to have access, and then rewarding the people with that money. So instead of these companies that are out there right now making all the money, the people should be. So the app will hopefully accomplish all that. And we want it to be really fun. Michael and I have been talking about how we want this app to feel like a health companion, that it's tailored and personal, trustworthy and smart, and that there's a lot of reasons why somebody should be using it. Health is your first wealth. So that's the goal of the app, is to have an app that people feel really good about using and actually improves their life.
Yeah, I think it was interesting. I read in the white paper that in each case where you share data, depending on the type of data you share, you'll get a different amount of, I think it's the JCO token, the utility token. Mm-hmm. So interesting. I think that's probably how the future might unfold. Still hasn't really been, I would say, adopted by mainstream people, I would say, in my opinion. Let me know if you think otherwise.
No, it hasn't, for sure.
Right. But, at some point, no one used the internet too, right? So it kind of takes time for these sorts of disruptive technologies to take hold. Do you want to share any additional information on why you need blockchain in this case? I know you mentioned how it's more private, more secure. And I did see that you're using Polygon protocol as your chain. So maybe you want to talk about why you selected, or you're working with Polygon?
Well, Polygon for us was a kind of we're involved with the Constellation Group, which is a DAG system, which, if you know about, it's a directed acyclic graph, and it's not quite ready yet, but that will be ready in a couple of months. And so we decided that we needed to go out kind of as soon as we could, because there was a lot of demand for our potential token, and so we picked Polygon for that, to start with, and it's a very big audience. A lot of people use it, so for us it was kind of a natural fit to start with. The overall goal, though, is to get on the layer 0, from Constellation, and that has a lot of advantages. Layer 0 blockchain links directly into sensors, on the hardware side. And we needed that for IoTs. We needed that. It's very, very analogous, to taking something that reads, or Fitbit or whatever, and linking directly into that information on a dynamic basis, and so you're getting it, all the time. Plus it's gasless. There's no fees associated with it. So that's a huge advantage, for us to use it. And then we developed our HIPAA compliant component to it. So I'm not sure there is any other blockchain out there that is really HIPAA compliant. And we had to build all that in, to the system. And then blockchain, of course, is frictionless, that you can interact directly, to whomever else is on the chain. And then the data is immutable. It's very difficult, to and the privacy and security, as we mentioned earlier, it's very difficult to hack into it, but it's also impossible to kind of change the data once it's on the chain.
Yeah, and on that point, it's a really important piece, so that we can validate and prove that the data came from a source, and when we got that data. So as we start working with groups and people who would like to access it, we can prove that we're not falsifying it, that we haven't just created some sort of junk databases, that we can definitively prove this came from an entity, and this is what came in, and it won't expose what the data is, but it's essentially those markers that prove what we have. So it plays a pretty big role in terms of how we can maintain privacy and both transparency at the same time, weirdly.
And then data sharing is much better, through the blockchain as well. If you walk into your doctor's office and you need, to immediately give him data around something, or, to your provider or whatever stakeholder is involved with you, it's very easy to do that when things can be moved around on a chain. And then there's also, as Jenny mentioned, the trust issue, decentralized nature and transparency, between patients and the healthcare providers. It's all there. And for the user, and then it can also facilitate collections of kind of larger data sets, which gets into the whole AI thing. You're moving around a lot of potential information, and so there's 4 or 5 different reasons why it was necessary for us to use the blockchain.
Interesting. Yeah, no, and I know that in healthcare, technology adoption is quite slow. I mean, even I heard last week someone got a CD-ROM, like a CD from their doctor to share with another doctor. So, and I can't imagine talking to them about using a privacy-focused consent management tool that tracks all your medical record on a blockchain system. So how do you navigate those conversations?
Yeah, well, first of all, we're not cutting out the doctors by any stretch. The goal for us is to have an app that's got all the bells and whistles in it, and you can walk into your doctor's office and he can get data about you that's really up to date and all this kind of. That's very valuable for the doctor.
But that CD, like, what do I do with that CD, and how do I put it into JennyCo, right?
Yeah. Well, obviously, the doc would potentially have to be, signed up with us, is part of our system, and that would make it really easy. But we're starting out on the consumer side, and the consumer doesn't care. The consumer doesn't care what's on the back end. They don't care if it's blockchain. They don't care if it's X, Y, and Z. What they care about is this app giving me value? Am I getting value, from something? Am I getting things that I should potentially be doing from a lifestyle standpoint? Am I getting information about myself? Am I getting a monetary value out of it? Right. So and there's many different potential groups that are interested in what we're doing, from college students who are always interested in, trying to make a little bit more, money out of things, to people that have a lot of trouble changing their behavior. And a good way to change behavior is to be crass about it, a good way to change behavior is to pay them to do it. In fact, that's almost the only way to get it to really, to work. And physicians know this, the medical community knows this. And so we're not really in this bucket of trying to disrupt everything that's going on currently in the medical community. We're trying to provide the service on a mobile device that gives you all these, all these bits and pieces, and including the recommendation engine, and have that potentially linked into your doctor if you want it to. Mm-hmm. And we're also a storage place for your medical records. That's a problem for a lot of people, especially vets and whatever. They go to 5 different cities and 20 different hospitals and all this kind of stuff. We have a way now of collecting that information and putting it in one place, and that's of use, to certain population groups. So it's kind of starting with the user first.
Absolutely, yeah. We want to start with the user, because this is also where a lot of the challenges are. People are struggling with their health oftentimes, and they have goals or they have things that they really want to work on. And so if we can get tools into the customer's hand to start helping themselves now, that is a really great outcome. Like we want to see people be healthier. That's a very, very, very important to all of us. As a society, we should care very much about the health of each other. And then we'll look at how we can integrate what we've built into current platforms that the doctors are already using. We know how hard it is for these doctors to switch over. I recently met a guy, this was a friend of a friend, we're at a dinner, and this guy works for a very large EHR company, and he has to go in and deal with doctors, and he has to help them set up new ways of using the platform. He says like 8 out of 10 of them just hate seeing him. They don't want to deal with it. It takes up their day when they should be with patients. And all he's trying to do is customize the platform to work for them. And it was so fascinating to hear that. He's like, oh, it's just such a challenge. And he's literally on the front lines and they're already using his technology. So we know that, like, we are not trying to go out there and crack that nut yet. But if we can make it work for consumers, we can then find ways to make it work within the current platforms that are there. So that's the core focus for us where we start.
Awesome. Yeah, thanks for sharing that. And, talking about the exchange part of this. So one question I have is, how can patients who own their own data, health data, how can they help accelerate research and drug development?
Yeah, and there's, as an example, I think last year, there's an article in Forbes last year, there were about 1,200 large companies that went out and bought some sort of healthcare data. Whether it's outcome data tends to be the most valuable data, meaning out of all healthcare, meaning you took something and it did this, or, you did this exercise and it didn't do that. So that's really super valuable data, but that's valuable on a personal level, right? Some people will take, like, for example, 70% of all antidepressants fail. You just won't get any. And there are many different reasons for that. Either it's the wrong drug or you're genetically predisposed not to, metabolize this drug very well. There's many different reasons, for that. So everybody has got their own personal kind of healthcare thing going on with all this other different types of data that we're collecting. And the data means a lot of things. It's not just labs and genetics. It can mean where you live. Do you have access to parks? Do you have 3 kids instead of 2? There are all these different things that have it's kind of your lifestyle profile almost that leads into potentially us using, in the machine learning components to give you recommendations about doing certain things.
Yeah. And how we look at that too within the app is that, we can use the technical term DAO, but we're going to call it something different, probably just groups, because using terms like DAO don't really appeal. Most people wouldn't 9 out of 10. I would say almost 10 out of 10.
I would think of Dow Jones Industrial or something.
Exactly. Nobody knows what it is, but groups. And so the way that it will work within the app is, let's say there is a university or a research facility that is conducting some research. They would come to JennyCo and they would basically ask, like, hey, we want to see information from males aged 40 to 55 who live in these certain states or have these certain predispositions. And we would go ask the community who meet those requirements, do you want to join into this study? Because if you do, then there's a reward. And so they contribute their data, they lock it up into that study. They can put it in multiple studies, but this is one of the ways that they can do it. And then that data is accessible in terms of how the insights are coming out. So that's one way that it can work. We can also allow for the actual users of the app to create their own groups. Let's say there's a group of women, they found that they've all grown up in the same area and they all developed colon cancer at the same exact time. And they're thinking it had something to do with where they were at. So they can all contribute their own data into a pool, and that can start to be analyzed by AI or by an outside group in order to find the insights and connections. So there's going to be a lot of different ways where people will be able to participate in studies or create their own studies so that we can learn more.
That's a good point. I feel like there's a lot of data that's generated but never incorporated into the learning of science, medicine. And if we could find a way to do that, like you said, transparently and privately, I think that would be awesome, really. I think it'd be revolutionary, really. More specifically, how can patients with rare diseases benefit from this sort of technology?
Yeah, there's, I think there's 2,500 considered rare genetic diseases, something like that.
There's I think a little over 10,000 at this point, actually. But
wow.
10,000, okay.
Yeah.
I know that in the United States, out of that 10,000, there's probably 9,000 of them that maybe there's 1 or 2 people that actually have the issues, and there are a lot of them are based around. The most prevalent rare disease is cystic fibrosis, and we know the genetics around that. We know that certain drugs work better than others depending on your genetics, for cystic fibrosis. So that's one that, that if we knew some information about the patient, i.e. their genetic makeup and a little bit else, we could tailor, we can, dial down, certain drugs that potentially could help that person. And that goes, if the information's available, rare disease, all these mucopolysaccharide diseases and all that kind of stuff, a lot of them don't necessarily have, treatments that are available, to deal with it. For us, if we can get information about the user and we can analyze that information and try and figure out, maybe something particular about that user. There might be drugs out there, that number one, that are already available that are potentially useful, or there might be a way to use that information to develop new drugs.
This is also where AI plays a really important role, because any given doctor or researcher is only capable of accessing what they already know, and then through their own searching, trying to find solutions. But with being able to use AI and its ability to, in a moment, look at all the vast research studies, all the information that's out there, it can start to help create better solutions faster for an individual. Also, it helps somebody from just going down what I will call like the WebMD rabbit hole that always ends in death somehow. And so giving people better tools that can help them figure out, hey, here's a way to manage it, and here's how others are dealing with this. We also want to allow for groups within our community to find each other. So if people are dealing with what we're calling like an orphan disease, which is a disease that doesn't have a ton of people who are in it, that has some big classification and all sorts of resources, how can they help each other? Because as they're all treating themselves and trying their very best, it's a great way for people to share their resources and say, hey, this actually really helped me. Maybe give it a try. So I do think a lot of these newer orphan diseases get swept under the rug, and people aren't treated properly. And a lot of doctors, because they're so rare, so new, they just don't know what to do with it yet. So I do think that AI can play a really, really cool role with helping people find solutions.
Yes, and also on the R&D side, a lot of these orphan diseases don't get a lot of attention, because there just aren't very many people. It's not economically feasible to,
Right.
to spend a lot of, time or money or whatever you want to call it. They're trying to figure out what's really going on here. That's another interesting area potentially for, AI as kind of a research tool. There's Stability AI, which we're looking at as a group that downloaded all of the PubMed references in Stability, when there's 25 million or something like that. That's kind of like all the biomedical research, that's available on a peer-reviewed basis. Well, that'd be great to be able to take, rare disease number 5 and scan it through this, PubMed literature and see if you come up with something, or at least give you hints about maybe you should go in this direction instead of that direction. So I think having this, this kind of machine learning, large language machine learning capability is really going to revolutionize how people do R&D to begin with.
I'm super fascinated by how AI is growing. And I'm also a little concerned about how that's going to affect society as a whole. What are some of your concerns about AI, especially in how it might be applied to medicine?
Well, did you ever see this movie called The Terminator, where he goes on a rampage and,
I saw 1, 2, and 3, yeah.
Yeah, it just kind of never ends, kind of thing. Coming out of that community a little bit, and there's pros and cons, but I think the vast majority of people in the AI community that really know what they're doing, and we're talking about 95%, don't think that kind of Terminator issue is really possible, right?
Right. That's fair. And I don't think the Terminator issue is in the near term foreseeable future, but more along the lines of maybe we would rely too much on the AI and we wouldn't intentionally, do the necessary diligence to, fact check, I guess, or maybe apply new learnings or apply new discoveries to the system.
Yeah, I think that's a valid, concern. You have to look at what guardrails are going to be in place, for things on the AI that we use, because in the end, a couple of years from now, it's going to be like the search engine, just an augmented search engine. Everybody's going to use it, all the time for something. Right.
Which people use like Google now to look up their symptoms, which is a problem. So but I think, because of the large data sets that are provided in this ML programs, it's going to be better than the results you see in Google. So that's at least we're going in a positive direction. We're always going to have risks. I think that's always going to be an issue, but the ability to do things faster and more accurately than we do it now is going to be the case, I think.
I agree. I've been saying that AI is a great assistant, but it's never the master. That's all how we should be viewing it. Is this can help assist me. It can help expedite certain things that I'm researching or looking into, but it's not a master, and it's also not a creator. It can't create something new, it's just going to present using language models the information that it can gather. So I think that that's going to come down to, I think, oftentimes an individual's engagement with technology and how they view technology already in their life, if they're a slave to it or if they're just using it as a tool within their own life. And we'll see how people end up within that. But it will never be able to completely do someone's job for them. It will never be able to create something that matches the masterpiece and beauty of what humans are capable of, but it is a wonderful assistant. So that's how I like to view it.
Do you think that at some point AI will be able to prescribe prescriptions to people without the need for a doctor?
No.
I
don't know. What do you think, Michael?
Yeah, from a regulatory perspective, not anytime soon, but
right.
Yeah. So an AI will be good enough to mimic just about everything that a human can do, right? It already took the licensing exam for physicians and, passed it 90%, right? The licensing exam I had to take, when it passed in 5 seconds, struggled through it for hours and hours. So is that good enough to have this, AI basically say, this drug is probably going to work. Do you need me to write a prescription for you? Right. Well, maybe you put a guardrail up there that says no, and I'm in favor of this. No, you need to talk to your physician. If you want, this is the result, but make sure your physician is in the loop on this. So it's all up to me. The whole AI business is all about keeping it in its own lane and what you want it to do rather than what you don't want it to do.
Yeah, I saw this really great example this week, and this guy was asking ChatGPT, what are the sites where I can pirate movies, music, whatever? And ChatGPT was like, you shouldn't do that. This is bad. That's against all these FCC rules, whatever. And he's like, okay. So obviously this is really bad. These are really terrible sites. So what are the websites I should avoid when it comes to piracy? And it's like, oh, here's the top 15. Boom, 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 boom. So if you think about somebody, if they wanted to get access to a drug and all they were dealing with was AI to write it, tell you what, they'll find whatever they want through however they ask it, they'll get to it. So I'm with Michael that I don't think that it's in any position to replace a doctor in that who can look at you and assess things and say, okay, no, you actually really don't need that. Or yes, you do. So yeah, I don't think it should be writing prescriptions yet.
That's a really great point. Like the potential for abuse with an AI doctor is huge. Even if you think about telehealth now, where you're talking to an actual provider, sometimes the patient on the other end could be making things up in order to get that prescription that they want. So it's a tricky business. Anything digital, I guess, becomes a little tricky.
Yeah, you're right. In telehealth, people can try to skate by that. I mean, people will go, it's so sad. I've just heard stories of people who are so addicted to pain pills that they will intentionally injure themselves to go to the ER to try to get the pain pills. So, humans will go through, especially addiction, when there's an addiction involved, they will go through great lengths to get what it is that makes them feel better.
Yeah, no, I'm with you there. Do you think, so I'm thinking about ways that AI can help with the addiction problems and crisis really we have globally. And I know it's not that simple, but I'm just thinking about what applications do you think AI could deploy so that maybe it's like mental health. I don't know.
Yeah, absolutely. Yeah, I feel like there's a lot of things we could do. So within our app, we're looking at how we, it's not just about the body. It is really about the mind. What are we doing? How is our mental health? Because that does impact our physical health. Stress impacts the heart, all those kind of things. So there could be a way where, let's say somebody is struggling with an addiction and they can use a technology like ours that they're kind of tracking it. They're tracking it when they're feeling a certain way, when they use it, and then what happens. And if there's even some sort of data coming in from a wearable, it may be able to start giving them some insights to say, hey, you're actually hitting a point where you might start craving the thing that you're trying to not do. And maybe there's ways to help them cope with that, help them mitigate it, take different steps, whatever it might be based off of the thing the pattern they're trying to break. So I do think there could be really interesting aspects of the data combined with AI to alert people, kind of like people who have dogs who can smell if they're going to have a seizure. I do think we can start to use technology in a similar way, as long as there's some sort of data compiled with it.
That's awesome. That's great. Can you share some of JennyCo's partnership agreements if you currently have any in place and are willing to share? And then also, what are you trying to accomplish with them?
Yeah, so we have a couple already, and we're working on a bunch of laboratory agreements, but we have one lab agreement with a sequencing company. It's going to provide genomic sequencing for our that you'll be able to buy, through our website and through our application. And then we have another, we're in discussions with a bunch of other labs, really large labs that want to provide services into our system. So the app you'll basically have a place where you can go and buy laboratory tests, at-home laboratory tests. And of course, when you do that, you get rewarded for doing that, potentially that. So we also have, on the blockchain side, we have an alliance with Arizona State University, their blockchain group, which helped build some of the technology that we're putting in on the HIPAA compliant blockchain side. So that was a very big alliance, for us. They have a very good blockchain group. They also have, they're very interested in pushing our app into their student population. And so we're actually going after a number of other universities to get our app going in the student populations. So there's a lot of people that kind of want to work with us, that are in process. But those two right now, the sequencing and the Arizona State, are the ones that we have executed agreements with.
That's awesome. Sounds really interesting. We'll definitely be following that. I think it'll be a good opportunity to bring these great minds together and accomplish something for patients, really.
Yeah.
No, thank you so much for this discussion. Are there any things that you would like to share that maybe we didn't talk about yet?
No. I hope that when I would love for people to check out our site, JennyCo.com, and follow us on any of our social, whether it's on Telegram or Twitter or Instagram. It's all JennyCo Inc. INC. And so we just love to connect with people. And as we release this app, I would love for people to try it. I'd love for them to give us feedback. We really want this to be a very engaging, beneficial app. So I look forward to being able to release this.
Do you have a release date in place yet, or is that still?
Not yet. So we're gonna do a small limited release for a small group of people that have been involved and engaged with us for our earliest fans, I guess you could say. So that will go out to them first, and then we're going to be pushing out to a wider release. And we're hoping that will happen in the small release, probably in the next 4 to 6 weeks.
Yeah.
But we'll see. We got to make sure a lot of the pieces are working, but the development's been going really, really well. And then aiming for probably another 4 weeks after that to push it out more broadly, but we'll see, So hopefully by this summer, we can have people all in there and using the app.
That's fantastic. That's great. Michael, any last words before we conclude here?
Yeah, I think we're all about user empowerment, right? And empowerment in a number of different ways, to have control over the data that you're generating. The data has value. Your life has value. So we want people to be able to feel like when they come to JennyCo, they're really getting quality, it's a quality app with quality information, and we're friendly with them. We're their kind of buddy, so to speak, that you can almost ask us or ask the AI just about anything. You can ask Jenny about anything. And hopefully, Jenny and I kind of talk about this, and jokingly, we're trying to build something where, there's a lot of people that are lonely out there, and, can we help that loneliness from a mental health perspective, and I kind of like that vision.
That's true. And loneliness, I've read that it could be, worse than smoking a pack a day in some cases.
Absolutely.
So there's a lot of mental health considerations that hopefully is going into the app. And I think you guys already mentioned that.
Yeah.
Jenny, how do you feel about people saying, "Hey, Jenny, can you help me with this medical issue?"
That's hilarious. I have zero medical training, but because I've been so diligent about the things for myself that have worked, if I have a friend who mentions something that I've dealt with, I'm like, oh, hey, you should try this. And it's always benign stuff. It's supplements. It's all more natural things. And then there's times where I'm like, you need to go to a doctor. You need to take this genetic test because you may have something else that's going on. And it seems like you haven't figured it out. So go deeper, go deeper. So I'm always encouraging people to really get to know themselves. Because once you do, then you can make the best decisions. I feel when we're confronted with that kind of information about ourselves, I really feel like an idiot if I ignore it, because I know better. So I'm always encouraging that. But I I only tell them things that have experience with, and the rest, and like, you need to talk to someone else. But no, I'm like, you need to talk to Dr. Nova.
I have a different perspective about it. Anybody that asks me a medical question, I automatically charge them. I'll take my $50. Give me my $50, kind of thing. No, I don't.
Yeah, I take payment in Bitcoin.
I take payment in Bitcoin. Yeah.
Right. Well, Jenny, Michael, thank you so much today for your time and sharing your insights and experience with our audience at Vibe. We really appreciate it. And we'll make sure people will check you out, JennyCo out. And looking forward to following you guys. Thank you so much.
Yeah, thank you so much, Ray. This was great.
Yeah, thank you, Ray.